Welcome to the Beat Pain Podcast, where we learn what actually works for pain relief, staying healthy, and navigating the medical world. I'm your host, Brandon Cope. In this episode, we dive into acute versus chronic pain treatment, surgeries, opioids, Western versus Eastern medicine, and the importance of open-minded and relational doctors. We talk about how doctors can be economically smart and entrepreneurs. My guest is a physician from a family of physicians. He played minor league baseball and now joins us to talk about pain and medicine. Please enjoy my conversation with Steve Haak. Hi, Steve. Thanks so much for being on the podcast today. It's really great to have you on.
Hey, Brandon. Well, thanks for having me on the show. I appreciate it.
You know, I'm thinking about how working with, people who come into a trauma center or they've had some kind of traumatic injuries, you know, one of the things they probably are going to want right away is like pain relief. You know, they might need to go on opioids, or they might need to have some other kind of care to help them with any kind of extreme pain they might be feeling. And I'm curious what your thoughts are with opioids, just in general, you know, pros and cons, why use opioids, why not use opioids, but particularly in cases of acute versus chronic pain. What do you think some of those differences are with opioids?
You look at the statistics and you're like, oh my gosh, there's 40,000 people that died from opioid overdose or whatever the statistic is. It's ridiculous, right?
Yeah.
And so you're just like, what are we doing? Why are we prescribing that? Blah, 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 blah. But then when you're training and nurse calls you and you got a patient that's she's thrown clot into her fingers and her fingers are cold and it's excruciating pain. She's getting no blood flow down there and she is in tears and she can't,
Right.
You know, it's like the only thing we got to throw the heaviest thing we got at her. You know, she's going to lose her fingers at some point, but she's in a tremendous amount of pain. So it's like, you're constantly forced in those situations. And it's like the what is acute is sort of outweighs everything else. You know, will this lady get hooked on opioids and could eventually die? Well, yeah, I mean, there's a possibility, but right now she's in a tremendous amount of pain, you know?
Right.
And I think like, that's the thing that I think as a physician or provider or whatever, you're always balancing that, you know, and trying to, I guess, explain what we're doing, because if it's like you just look at like, oh, this is black and white, it's not necessarily like that, you know. It's kind of there's that gray area.
Yeah. There's definitely lots of great things. Yeah. And I mean, when somebody has serious pain in the moment, I mean, how much of this pain is, you know, justifiable? You know, at what point is it like, okay, we can't let this person have pain anymore? It's not worth it. You know, that's a hard judgment call.
You cut somebody open, obviously it's painful, right? And they're going to have pain for days on after that. So, you know, we have to be conscious of, are we treating their pain, and are we giving them enough compared to, are we giving them too much? Because, you know, if they get too much, or if they get, and I think there's been some good legislation that's been passed that sort of made it a little bit, I guess, put some restrictions on the prescribing patterns of physicians. You know, you can't just, you know, pass out a bunch. Another experience I had in medical school, when I was doing psych, I had a kid who was like 29, and he was a welder. He was a welder, you know. So he had never drank in his entire life. He had never done drugs, never drank. And he injured himself. I think he hurt his shoulder or something, and he was put on narcotics. He started doubling up. And he's like, you know, I kind of like the way that feels. And then, so I somehow he was able to get prescription opioids. And then it got to a point where he was able to get heroin cheaper on the street. And he was a heroin addict, and he was 29 years old, and it all had happened within a year after a surgery. So, you know, that's a scenario, that's a case of everybody kind of failed, you know. I don't know exactly the history as far as the surgery and the follow-up and all that stuff, but I think as physicians, and I think we are becoming more and more, but you got to be aware of those types of things, you know. You got to be, and I think it helps with just having relationships with patients and understanding, asking questions, asking the hard questions. And then if you feel like you're sort of out of your realm of expertise, then you got to get somebody that knows what they're doing,
Yeah.
But and that's the majority. I think there's a lot of people that are like that. Either they're getting it on the street somehow and they don't really know the harmful effect of it. It's one of those things that you're never trying to overdose. You just do. You actually asphyxiate. That's how you die. It causes respiratory depression, where your diaphragm just doesn't work. It doesn't pull the lungs down to create the negative pressure.
Mm-hmm.
So yeah.
Yeah, I actually just watched a movie. It's that new movie called Knives Out, which is really good. In the movie, there are these characters who overdose on morphine. There's a character who has an overdose, and they actually show the character is asphyxiating. They're trying to breathe and they can't get air, and they're just kind of gasping. And it's kind of horrific in the movie, but it's like, oh wow, that's what's happening when people are overdosing. And I think that you're right. A lot of problems in terms of either miscommunicating or misdiagnosing or understand just that lack of understanding with a patient in any kind of situation in medicine or pain or anything. A lot of times that can be fixed just by building a relationship with that person. That's true in my office too. A lot of people come and see me because I have longer sessions, and because I'm just kind of my solo practitioner, I get to spend a lot more time with that person one-on-one. They see my face, they're talking to me, I get more information from them. And there's kind of that sort of leisurely time of, we just get to know each other and have a relationship. And a lot of people like that because it's personal to them. This is their health, their body, their life. They want somebody who cares about all that stuff, and that's changes things for people.
I think what happens is say somebody comes in with, they had their gallbladder taken out, or they had an appendicitis, or they had, something where they were open. And so we might give them a few days worth of opioids, and usually Norco or OxyContin, something like that.
Okay.
They'll go home and whatnot, and they'll take their meds if they need it. If they don't, then they won't. But if they need more, then what they need to do is they need to go to a pain specialist, and that doctor can kind of, figure out, have a little bit better idea and a working relationship with that patient. So that, I think that's on the acute side of things. On the chronic pain side of things, again, that's a patient would go see a pain doctor. And I know obviously opioids are used in that setting, but from my perspective, and I'm sure the pain docs and probably most doctors would agree, is anything to reduce the amount of opioids is a good thing.
Yeah, totally. Now, you're talking about how, you might go see a pain specialist and they're going to help you understand, doing opioids or using other kind of treatments. And I want to talk a little bit more about what those other treatments might be. If somebody's getting to the point where they might have to have opioids, but they want to avoid that. And you're talking about, some of the work that I do, doing manual therapy and exercise therapy with people, or people getting massage or doing other kinds of techniques. I mean, how open-minded does our healthcare system need to be about other treatments? I mean, how much outside of the box should we get to try to find out, what works? Where for the person in pain, what should their mindset be about those treatments?
I think people just need to keep an open mind in general. A great example. I did a integrative rotation at University of Arizona when I was in medical school. One day I was assigned to go shadow an acupuncturist. So I knew nothing about acupuncture. I knew nothing about it. But that was actually probably one of the best days of medical school. It was incredible. I had no idea all of the different things that this guy treated. And I think he was an electrical engineer by trade. And he went back and he got his, certification or degrees in Chinese medicine and acupuncture. And that's how he treated patients. And there was one patient in particular that stood out. And this guy was probably in his 80s. And we walked in the room. He was already in, that massage chair where their head is kind of in the pillow type thing. He's kind of in that thing. And in his 80s, he's retired. And what he did for work was he was a motorcycle patrol officer for the Oakland Police in Oakland, California, and he had this chronic low back pain that he had been to every doctor. He had tried everything and he had no relief, nothing.
Wow.
And I don't know if he was taking any opioids or what he was taking as far as medications, but his wife had drug him to his first acupuncturist appointment, and they usually do about 10 appointments. And he was on his third or fourth appointment, and this guy swore by it. He said, "This is the only thing that's helped me." So I think people in general, especially if they're not having relief with something, I think usually they'll be a little bit more open-minded, especially if something travels word of mouth, and they get it from several people, like, "Oh, hey, I went and saw this guy and he did this, this, and this, and it's really helped me, and I don't need the medications anymore." So I think it's on an individual level, and I think you would see patients, if they're not getting the relief, I think they'd have a tendency to have more of an open mind.
Yeah.
Surgery is really acute care. Usually people are really sick. In general surgery, we're basically dealing with, the abdomen, everything that's in the abdomen. And, people will come in with small bowel obstructions. They'll come in with, perforated ulcer. They'll come in with perforated diverticulitis or something. They're septic, or they've got gallbladder. Maybe they got, maybe they're getting septic from cholangitis or something like that. So that's sort of what we do in surgery. And at that point, you're trying to figure out what's this patient going to die from, and what do we need to fix? And not everyone's that acute, but people will come in with different types of issues, and again, we'll get our imaging, our CT scans, and based upon a history, we'll try to figure out what's going on, and then go from there.
Yeah. Now you're talking about how surgeries are really efficient for, a lot of different things, and for acute medicine. And I know that here in the United States, we get really into our surgeries. And I'm just wondering, what are things that you think just in America, in kind of Western medicine, we were sort of comparing surgery versus like acupunctures and kind of the different sides of Eastern medicine. But for looking at the Western medicine model and what kind of things we do over here in the United States, what would you say are some of our strengths in medicine?
Our acute care is great, is fantastic. I think the research that we do is really robust. There's a lot of things I think that we do better than the rest of the world. There's no doubt. And surgery, certainly, I can speak from general surgery's perspective, is, there's no really other treatments for somebody comes in with appendicitis. I suppose you could sit on it or treat with antibiotics. I'm sure there's a study out there. But usually it's like, okay, well, this is the problem. Like, this is what we can do to take care of it and get the patient to feel better. Certainly, people have small bowel obstructions, that has to be dealt with, and or if they got some kind of perforation, those are things that will kill somebody. So that's when surgery is most needed. And we do a very good job of that, I think. I think as far as like chronic conditions, I think we have a tendency in our country to think, oh, we'll just take a pill and the pill will make everything better. And maybe that will, they do have efficacy. They do help, but I think, is it most optimal? And no, maybe not. I think like just some of the old fashioned things, that are probably not as popular, eating healthy and getting exercise and getting sleep and doing things to reduce stress and meditations and community, all of those things are very important to our health. And we probably don't do as good a job as we could here in the United States.
Yeah, well, I mean, if we could be more stressed here in the United States, we probably would be.
Right, exactly.
We definitely suffer in a lot of those areas just as a culture. So I definitely hear you on that. And I think you're right. I mean, if you've got a condition Like, I'm just thinking about myself. If I've got a condition where it's like, you got to cut that thing out of you or you're going to die in 24 hours, I probably want to be in the United States seeing one of our doctors, like that's probably where I
Absolutely.
want to be, you know?
Absolutely.
Um,
Yeah.
but I mean, going back to the Eastern medicine here, does Eastern medicine and Western medicine, like, do they have to be opposing each other? Like, could they be working together in a certain way?
I think maybe in years past, 50 years ago or something, patient went to the doctor, whatever the doctor said they did.
Yeah.
And it's not as like that as much. I think patients are a little bit more, have a general knowledge or idea about things and can go on the internet and look things up and look for different modalities and look for people's experiences with those modalities. We can still do things that we think is best. We think, well, this is in the patient's best interest. This is what they should be doing. But I also think we shouldn't, if the patient wants to try, something else or a different modality, we definitely should be open to that idea. And I think overall, what we need to focus on is just the overall health of our patients and the population. We can't ignore some of the problems that we're having with the obesity and what all the problems that causes, and then diabetes and type 2 diabetes and high blood pressure and all of these types of things. So we can treat all that with drugs, but probably the best way to mitigate that, if you can, is to do it as naturally as possible. Be within a healthy body weight, getting plenty of exercise, making sure you're sleeping, making sure you're reducing stress, you have healthy relationships. All of those types of things are very important, and that should be the goal and the aim of any provider.
Yeah, absolutely. And you're making me think of the oath, first do no harm.
Right.
And I'm just thinking of how, if we could just capitalizing on that word first, like first things first in our life, if we could prioritize certain things and understand what we need in our health in terms of, exactly what you're listing, sleep, food, community, stress, then that would prevent all of that later harm, in so many cases for a lot of people.
Absolutely.
And I also wonder, just again, thinking of that oath, first do no harm, I'm thinking about how for people, for doctors who are looking at somebody's condition, when a doctor can look at a condition and say, you know what, the best thing for you would be to not actually come in and see me. It would be for you to see something that's maybe a little bit outside of the box here.
Yeah.
For a doctor to have that insight and that knowledge about what's going on with somebody's body, that's like a step down, that hurts the ego a little bit, like that as a, in that position to say, like, actually, you don't need to see me. It's like,
Yeah.
that's a level of humility that you really have to be able to respect. And I think that we are becoming more aware of other kinds of medicine that are very helpful for chronic conditions and more long-term conditions that doctors are now recognizing and looking at. Just like you're saying yourself, you got to be able to look at these other things and see what is helpful and be able to, experiment or use some, different products or different services and understand, okay, this is going to treat this condition really well. And if a doctor can recognize it, that's a great place for that doctor to be, and I have a lot of respect for them. I'm thinking about all of this experience for you, going through medical school, living in a family with doctors, some of the things that you've shared today. And I just wonder if you were to talk to yourself way back when you were 18, or maybe even before you were 18, just when you were growing up and you were thinking about, what am I going to do when I get older? What kind of advice would you have given to yourself all the way back then?
Everybody can look at their life and be like, oh man, I wish I would have done this different, or this different, or I screwed this up, or what we sort of perceive that was not the right thing. But we don't know what the final outcome is, and we don't know and so maybe a lot of these things that we did or pursued or whatnot, that maybe we thought, man, that was kind of a waste, or that sort of distracted me, might have been the very thing that put you on the trajectory to be where you're supposed to be. Playing a professional sport or playing a sport in general, it's just so difficult to actually get to that level where you're, what you see on TV and these guys making these incredible salaries. It's just so, it's just one in a million or more, and so sometimes I'll look back and think, man, that I kind of chased this a little too long, or what. But I don't really um, look back and think, I had some really wonderful experiences playing baseball, and played for some great managers. Actually, I only played for two managers in 8 years. Well, for 2 weeks, my first year, I played for another guy. But they were all of these guys were great leaders,
Hmm.
and I learned a lot from them. And you learn a lot from being on a team, and you learn how to interact with people, and you learn how to, just how to be successful within a group. And I think it's so important to understand that, that, hey, I can have my own success, but also the team success is what matters most. If I'm doing really well, but my team's losing, well, that's no one's happy. So those experiences that I had, they're pretty valuable to me, and I
Hmm.
appreciate the fact that I have them. And I know there's not too many people that are in medicine or doctors or whatever that had that opportunity to play professional baseball. I'm sure there's probably some other professional athletes, but I don't think there's too many baseball players going into medicine.
Yeah.
I guess sometimes I'll look at some of the students, or the people that are a little bit younger than me. They got started a little bit earlier. It's like, well, but then you know what? They didn't have the same experiences as I did playing minor league baseball. So
Yeah. And you said something earlier that really struck a chord with me. You were talking about how you don't know what experiences you're going to have, that at you might think those experiences were a waste, but maybe those experiences brought you to where you are today.
right,
And it's kind of crazy to think about something like that, because you could live your life looking back at all the things that you would label as wrong, or those experiences shouldn't have been there, and you could just be filled with regret. If only I'd started school earlier, if only I'd gone to a different school, if, oh man, I can't believe I got into that car accident, that whatever happened, I went into debt at this point. You could just look at a whole bunch of different stuff and view it all as regrets and mistakes, and why did this happen in my life? But at the same time, those things probably made you who you are now. Like, those things have probably shaped you and changed you in certain ways, and they've probably helped you to mature and grow in certain ways. And so, I mean, for you, you're talking about your baseball. I'm thinking about, if somebody has been in chronic pain, if somebody's gone through a serious injury and they've had pain for years, they could look at that experience and think, man, I regret that. I wish I'd never had this whole pain experience. My life would have been better if I'd never, ever had this. This is terrible. But you've probably learned certain lessons about life through that experience that you never would have outside of it. You've probably learned a certain level of humility, or appreciation, or just understanding about what happens inside the emotions of somebody, or suffering, or you have a certain ability to empathize with other people who are in that same situation.
right, right,
It's really powerful when people can have experiences and look at the good in those experiences and not just the bad.
right. Right. And I think, another thing is when I was playing baseball, in order to play in the summers, I'd have to hustle pretty hard in the winter, just doing a bunch of different things. And so I've done a lot of different jobs, and I've worked in sales and business and whatnot. And that's something that, when I look at medicine, I don't think that they're mutually exclusive. I think that we need more physicians to be entrepreneurs, and I think also be advocates for our patients, as far as the financial burden that that the cost of healthcare. So anything that we can do to reduce the cost and help our patients financially, I think we should be concerned about that. And I come from you know, a great example is when I was selling hearing aids. My hearing aids that I would sell would be anywhere from $5,000 to $9,000 per set,
Wow, that's a lot of
and
money.
it's a lot of money. And Costco would sell them for, maybe they had one that was around 5,000, but they were usually cheaper or less expensive. My biggest competition was the VA. They sold hearing aids for $0. They're
Oh,
obviously
wow.
subsidized. But you know what? Patients would, even if they had that hearing aid that was offered to them for free, they would still opt to buy the more expensive hearing aid from me. And what the reason was is because they had no aftercare once they got the hearing aid. There was no one to adjust it. There was no one to clean it. If it broke, it was up. So they were willing to pay a little bit more money to have me, is basically just help them with their hearing needs. So um, you know, there's a lot of competition and that sort of. But competition is what brings the price of things down. And I think in healthcare, a lot of times we don't know what the prices of things are. I think that may be changing, and so patients can have a better idea. From my, if I can share a personal experience or
Please
story, if
do.
you don't mind. I recently had to get some labs drawn, and my insurance, my deductible is really high. So I work in a hospital. So I went to the hospital where they draw labs, and I said, I need to get these labs drawn. How much does it charge? Or how much does it cost? And she says, oh, we don't know. And I said, well, I need to know because I'm paying for it. And I said, because if I get an expensive bill, I'm just not going to get the labs in. And she says, well, you'll have to talk to this person. And so I talked to this other person. I think I had to talk to the insurance. Well, finally get it back, and it was going to be like about $900 or something for these labs. And so I said to the lady, I said, well, I can't pay. I'm not going to pay $900. Do you have, what kind of discounts do you have? Otherwise I'm going to find somebody online or try to find some place where I can find it cheaper. So she comes back to me a few days later and she says, we'll give you a 70% discount.
Whoa.
So now from 900, we're down to like 200 something. I was like, oh, I was perfectly fine paying that, but I just pushed my luck a little bit further. I was like, is that the best you can do? Or what else do you got? So I finally got the final bill in the mail, and it was $86.
No
So,
way.
so you wonder, in our country, things are so expensive, but it's like the insurance pays for it. Who cares,
Hmm.
Whereas I think if people really, you really had to uh, be concerned with price, I think you'd see these prices coming way down. So
Yeah, that is fascinating. And I would love to see doctors mix with entrepreneurs and create new systems to things. That's really interesting. Is there anyone in kind of that doctor entrepreneurial genre that you've been really interested in, or just any kind of changes or movements you've seen that have really impressed you?
Oh yeah, well, there's a lot of things going to telemedicine and online with apps and that sort of thing, and I think that's just great for everybody involved.
Wait, tell me, what's telemedicine? Is that like you call your doctor and you talk on the
Yeah, so
phone,
like
or?
there's different apps you can download, right? And um, I actually don't know of any. I just see jobs every now and again for telemedicine. But so essentially, what you do is there's apps you download or whatnot. You've got an ailment, you pay the fee or the money, whatever it is. Usually, it's not that much, and then you're able to call and access a physician. But then the physician's on the other side, and they can pick up the phone, or if it's a text or whatever it is, and you can have a conversation. And it's like, oh, okay, yeah, you've got, maybe you got strep. You got to go get a test, or I'm going to call in some antibiotics for you, or just all kinds of things. A lot of times it's skin issues. So there's a lot of things that just sort of saves everyone time and money. A lot of times family practice physicians it's hard they're jam packed weeks on end, so it's hard to get in to see them. And then another thing that's kind of, I think, becoming more prominent is urgent cares. Urgent cares are a good way if they got something that's bothering them and they don't want to go to the emergency room because it's they can go to an urgent care first, and then they can determine, okay, yeah, you need to go to the ER, and you got to get an x-ray or whatever it might be. So and urgent cares typically are a lot less expensive than going to the emergency room.
Hmm.
So there's a lot of I think a lot of things. I think the biggest thing is maybe eliminating some of the barriers of entry. I know like a lot of states have this idea of certificate of need, and I think sometimes that maybe protects the the bigger industry and sort of stifles any kind of competition. So I think those are things that that could help. I think ultimately the consumer, should choose. The patients, they should choose what they want. And I mean, that's what you sort of see in every other market. I mean, everyone walks around with more computer power in their pocket than what they sent to the moon. So, and that, virtually everyone can afford that. And that's, because of the market forces working on technology and competition and all of those types of things.
Yeah, absolutely. I mean, it is interesting how technology has changed the economy,
Right.
and it's changing medicine, which is changing the way that we're spending our dollars when it comes to medicine. And
Yeah.
I mean, that sounds pretty efficient. I feel like I've maybe seen an advertisement or something like that for a medical app where you could like almost FaceTime with your doctor, which makes sense because sometimes, you've got a weird thing on your skin and you have no idea what it is, and the doctor doesn't really have to like do it. They just need to see exactly what it is. And if you
Right.
can just like, hey, I took a photo of this thing on my arm, what is that? And they can
Right.
be like, oh, I recognize that, maybe try this or that, or they can prescribe something. I mean, like, that only needs to take 2 minutes, like you don't have to
Yeah.
go wait in line and fill out all this paperwork, show up. Now you're taking 10 minutes of the doctor's time. Okay. It's like,
Right.
it can make things so efficient, save people time and money. And that would be, if we come up with more systems like that, then we could eliminate a ton of problems just by understanding, really just, I mean, business pretty much, just
Right.
understanding what consumers need for medical
Right.
systems. Yeah, that's great. That's super
It's like
cool.
the Uber of medicine.
Yeah, that's funny. Yeah, yeah.
Another thing is social media. I also think is a pretty good um, avenue. Uh, there's a doctor that I follow is actually a friend of my brother's that I met once, and he's got a pretty good following on his social media,
Hmm.
and he specializes in weight loss and sort of a lot of the things that we're talking about, just getting people to be optimally healthy and using the most natural means possible. And it's usually just the hard work of uh, eating healthy and exercise and sleep. I mean, those three things would cure most of our problems.
Hmm.
There's a friend of mine sent me a TED talk by this physician, and she was in San Francisco, and she realized they did like something where their patients would have to fill out all of this information. It was about childhood trauma, and it may not have been like physical trauma. It might have been like a parent that left at an early age, or maybe it was physical abuse, or maybe it was sexual abuse, or maybe it was just bullying in school, or maybe there was these things that they would fill out. And what they found was there was a correlation with all of these things that happened in um, these people's childhood, with all of these comorbid conditions like obesity, like hypertension, like diabetes. And all of those things are kind of go hand in hand. But it's so interesting. It's like how this our emotional health, the way we are programmed and the way we view things, and the nurturing that we received or didn't receive as kids, and how that affects our health as an adult. So and I saw this last year. I remember we dealt with a lot of bariatric patients that were 500 pounds. And this one woman, I had to go up and see her because it was a bariatric consult. It was kind of odd. And she was there because she can't breathe. Well, she can't breathe because she's just so, I think that's why she was there. She was just so fat, so heavy.
Wow, that is
And
scary.
I came and I talked to her. Sure enough, this woman like just shared so many things about her childhood, like just her upbringing, what her mom and all these things, because she was lamenting like, I'm so fat, and I've just taken comfort in food, and the reason is this and this. And I just think, like, as physicians, I know there's only so much time in a day and whatnot, but I think it's so important for us to look at people in every aspect of who they are, and give them, everything that we got, and understand and learn. And because it's like, okay, yeah, we could give you bariatric surgery and you're going to lose some weight like that, but it's like, are we going to get to the core of the problem? The core of the problem is some of these issues that you've had, that you've medicated yourself with, food or whatever it might be. I had a lot of kids with that were shooting up drugs, or shooting up heroin, I guess, or whatever it was.
Mm.
And they'd have all these abscesses all over their body. One girl was like 26, and she had all the septic emboli all over the place. And
Wow.
and it's like, yeah, we can go in, and there's some things that we can do that could help the particular acute problem that she has now. But is that gonna, like, help that person? And I think at that point, it's like, we're getting into some spiritual issues and that sort of thing.
Yeah, that is really fascinating to think about the origins of certain problems, and if they do have a spiritual, emotional component. Like,
Yeah.
is somebody neglecting their health, not because they don't know, like, the information, the head knowledge of what they need to do to be healthy, but are they neglecting their health because they had, some kind of abuse as a child, or they have some kind of depression, or it's a comfort mechanism because they don't feel loved or accepted by other people.
Right.
Like, that's, if we could change how we treated each other, and how people, what their health was emotionally, where they're at spiritually, would that totally change what's happening in health right now?
I think what we're talking about as far as the entrepreneurial or the business aspect of things, because, we had a family physician come in and talk to us the other day, and, she sees 60 patients a day. We'll do the math. I mean, she's maybe spending 5 minutes per patient. And is that enough time? There might be times where it's like, you don't really need to spend that much time for people with people, but is that enough time to, we got somebody with some of these issues to really kind of get to the bottom of it, and help them. And what my dad does now, he does this functional medicine, and he does a lot of the bioidentical replacement hormone therapy, a lot of micronutrition. He's got things, just guidelines as far as what they should be eating. He's got guidelines as far as or recommendations for workouts and that sort of thing. And he spends an hour with each patient, but they pay cash for it. Insurance companies are not going to be like, oh yeah, we'll pay, the doctor wants this. They're not going to do that. So I think it's incumbent upon doctors, to think outside the box, I guess, and to look for ways. And that's also, I think, how technology can be used. In these social media platforms, some of these guys are just putting out so much good information that anybody can access if they want it.
Well, Steve, you are a different kind of doctor. You have a different mindset. And I think that you really, you get outside of the box, you go against the status quo, you're up to date on what people need and what people are thinking. And I really appreciate your insights today in talking on the podcast. I look forward to hearing more from you in the future, just as you grow and change and learn, and you're doing more research. I really appreciate you being on here today. So thanks for taking time out of your day. Thanks for giving us a lot of info and stories and explanation for what's happening with medicine. And, I best of luck to you as you continue forward in doing all of your research.
Thank you, Brandon. I appreciate it. Thanks for having me on the show.
Thanks for listening to this episode with Steve. If you want to be involved with the podcast, there are 2 ways for you to do that. First, if you have any questions that you want answered or topics you want us to talk about, then click on the BEET Pain website link in the show notes and message me. Second, if you want to continue listening to great content and guests, then I need your help to build the podcast and get those guests on the show. The bigger the podcast gets, the easier it is for me to bring on more guests. Subscribing, writing a review, and sharing this episode with others helps this show to grow. Thanks so much for listening.